You are listening to the Pregnancy Podcast with Vanessa Merton.
Hello. Thank you for tuning into the Pregnancy Podcast. In today's episode, we're talking about exploring your options for a birth center. A birth center is the middle ground between a home birth and a hospital. You get a home-like setting and midwife-led care built around a low-intervention birth. This is not the right fit for every pregnancy, and not even the right choice for everyone who is eligible. But this is an option that many expecting parents never seriously consider. Part of that is that a birth center is less familiar than a hospital, and there's also many misconceptions about what the experience is like and how safe it is. Whether you're curious about a birth center, weighing it against a hospital or a home birth, or you just want to understand all of your options, this episode will walk through what makes a birth center distinct. It will also cover what to expect from your first prenatal visit through having your baby, going home, your options for pain management, and the evidence on safety and outcomes. You can see the full article and all of the resources for this episode at pregnancypodcast.com/birthcenter. Today, I'm breaking down what the experience is actually like having your baby at a birth center and what the evidence says about the safety. Premium members get hundreds of episodes like this one, with a deep dive into all of the evidence and research, plus it's all ad-free. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium. Zoller goes above and beyond in formulating their Prenatal Plus DHA. It's made with high-quality ingredients like the active form of folate, bioavailable iron, and essential nutrients like omega-3s. In May of 2026, save 40% off the Zoller Prenatal Plus DHA on Amazon with the code PREPODS40. You can always see the current promo code at pregnancypodcast.com/vitamin. VTech is the #1 baby monitor brand in North America and trusted by millions of families. The VTech VM5266 baby monitor has a 5-inch color screen. You can pan, tilt, and zoom from the parent unit, and sound-activated soothing. It's available at Target. Check it out at pregnancypodcast.com/VTech. 8 Sheep Organics makes amazing 100% clean, natural pregnancy products. From skincare to treating common pregnancy symptoms like stretch marks with clinically proven ingredients, 8 Sheep has you covered. Every product comes with a 100-day happiness guarantee. If you are not 100% happy with your purchase, simply send them an email and they'll get you a refund, no questions asked. Check out 8 Sheep Organics and save 10% when you go to pregnancypodcast.com/8sheep. A birth center is a healthcare facility that provides prenatal care, birth, and postpartum care for healthy, low-risk pregnancies. The idea is that it provides a home-like environment paired with the midwifery model of care. Birth centers are designed to feel residential rather than clinical. Instead of a hospital bed under bright lights, you're more likely to find something that looks like a regular bedroom, with a private bathroom, a deep tub, and soft lighting. There is some clinical equipment present, but it's in the background rather than the focus. It's just as important to be very clear about what a birth center is not. This is not a small hospital, and it doesn't have most of the hospital's medical capabilities. There's no operating room, so a cesarean is not possible at a birth center. There's no anesthesiologist, which means an epidural is not an option. And there's no neonatal intensive care unit. A birth center is designed for healthy, low-risk pregnancies, and it relies on a relationship with a neighboring hospital for situations that require a higher level of care. There's two main types of birth centers. The most common is a freestanding birth center. This is an independent facility that is not physically part of a hospital. Then there are hospital integrated birth centers. These are located within or attached to a hospital, but they operate as a distinct unit. There's no single universal definition of low risk, and the exact criteria will vary by birth center. Generally, you're a candidate if you are pregnant with a single baby, your baby is head down, and you go into labor between 37 and 42 weeks without any significant medical complications. Certain conditions can move a pregnancy out of the low-risk category, which would make a birth center unavailable. A few common examples are high blood pressure, gestational diabetes, and carrying twins or multiples. In these cases, a hospital is almost certainly going to be the recommended venue. Birth centers account for a very small share of births in the United States. According to CDC data, about 98% of U.S. births happen in a hospital. The remaining 2%, these are sometimes referred to as community births, are split between home births and freestanding birth centers, with freestanding birth centers accounting for about 0.5% of all births. And the U.S. is unusual here. In many other high-income countries, midwives attend a much larger share of births, and out-of-hospital births are more common and better integrated into the health system. Birth centers are regulated and operate within a framework of standards and accreditation. The American Association of Birth Centers sets the national standards for birth centers, and the Commission for the Accreditation of Birth Centers is a separate independent body that accredits centers against those standards. A few states require accreditation, most do not, although many centers still pursue it because state Medicaid programs and private insurers often require that accreditation for reimbursement and contracting. When you are evaluating a birth center, it is a very reasonable question to ask whether they are accredited. That could factor into your comparison if you're looking at more than one option in your area. A few features really set a birth center apart from a hospital. The most important is the midwifery model of care. This is probably the single biggest difference, and it has more to do with midwifery care over obstetric care than with the physical setting itself. Midwifery-led care treats pregnancy and birth as normal physiologic events rather than medical conditions that need to be managed. In practice, that means longer prenatal appointments, more time for education and shared decision-making, and a very strong emphasis on allowing labor to unfold on its own while minimizing interventions. Another defining factor is that a birth center is designed for low-intervention, unmedicated birth. If you plan to give birth at a birth center, you're planning for a birth without medications. An epidural is not available, a cesarean's not available. For many parents who choose this setting, that's part of the appeal. And it's important to understand that a birth center or a home birth is not your only route to an unmedicated birth. If you want a low intervention, unmedicated birth, but you also want to have your baby in a hospital and have that medical pain relief available as an option, it's entirely possible to do this in a hospital. There is a full episode of the podcast that focuses on a natural hospital birth that goes into a lot more detail on that. Birth centers also differ from hospitals in size. A hospital is built to handle a wide range of services and medical needs. A birth center has a much more narrow focus. On the positive side, a smaller facility means that you're likely to meet most of the staff during your pregnancy. There's often more room to individualize your care than there is at a large hospital that may have more rigid policies. But on the other side, a birth center has a limited number of rooms, and they can only care for a limited number of clients at once. A hospital labor and delivery unit is staffed around the clock. You can show up at any time. A birth center is staffed for births, but it's not open 24 hours a day. So if you think you're in labor and it's the middle of the night, you need to call your midwife to ensure that the team can meet you there so someone will be there to greet you. This is a small logistical difference, but definitely worth knowing in advance. Although birth centers are distinct from hospitals, they do operate within the larger healthcare system. Most birth centers are not an island. They maintain relationships with physicians and with one or more nearby hospitals. So in the event that you need care beyond what the birth center can offer, there is a clear path to transfer your care. Midwives and nurses primarily staff birth centers. This is the root of what makes it different from a hospital, where you have obstetricians attending most births. So it helps to understand the midwifery model and the types of midwives that practice in the United States. There's 3 midwife credentials in the U.S., and they differ in training and where they can practice. You have a certified nurse midwife. This is somebody who becomes a registered nurse and then completes graduate level midwifery training. CNMs are licensed in all 50 states and the District of Columbia. They practice in hospitals, birth centers, and homes. Then you have a certified midwife. This is someone who has a background in a health field other than nursing and then completes a graduate level midwifery program. They meet the same competencies as certified nurse midwives. They take the same national board exam, but they're not nurses. Certified midwives are currently recognized in about a dozen states, plus the District of Columbia. Then you have a certified professional midwife. This is a direct entry midwife. They're trained specifically for out-of-hospital birth, and they practice in homes and freestanding birth centers. Certified professional midwives can be licensed in about 37 states, plus the District of Columbia. You don't need to memorize all of these, but you should know that the type of midwife that staffs a particular birth center really depends on the center, and it depends on the laws in your state. The midwifery model really emphasizes continuity of care. So that means that you're building a relationship with the same provider or with a small group of providers throughout your pregnancy, birth, and postpartum. A Cochrane review comparing midwife-led continuity of care with other care models found that people receiving midwife-led continuity of care were less likely to have a cesarean or an instrumental birth, more likely to have a spontaneous vaginal birth, and more likely to report a positive experience. That research is really more about the care model, not the building or the setting. But a birth center is one of the settings where that model is most fully implemented. Many birth centers also work with other professionals, so they may bring in lactation consultants, childbirth educators, doulas, nutritionists, counselors, chiropractors, or acupuncturists. One practical question worth asking early is who will actually attend your birth? Some birth centers have a small enough team that you may have a specific midwife present. Others work on a call schedule so that the midwife who attends your birth is the midwife that happens to be on call when you go into labor. If a birth center does use an on-call model, you will generally meet the other midwives during your prenatal appointments so that whoever shows up to your birth is not an unfamiliar face. No matter where you plan to give birth, the clinical content of your prenatal care is pretty similar. What tends to differ is the style and length of visits. If you plan to have your baby at a birth center, your prenatal care will usually take place at the birth center itself. Prenatal appointments with midwives are typically longer than standard appointments with obstetricians. More of that time goes to education, to answering your questions, to talking you through your preferences. Birth centers also tend to involve you more actively in your care. You may be asked to do things like track your own weight or take part in parts of your assessment. Some birth centers offer group prenatal care. This model is often called centering pregnancy. So with this, you start with a one-on-one visit and exam, but then you join a group of other expecting parents that have similar due dates for all of your routine appointments. So each session then combines a private health check with your midwife and then a longer midwife-led group discussion. Research on group prenatal care has generally found outcomes at least as good as those of individual care. For many parents, it's a great opportunity to meet some other expecting parents in your area with similar due dates, and it's nice to have a sense of community within those appointments. One thing happening throughout your prenatal care is ongoing risk screening. Your midwife is continually confirming that you're still a good candidate for a birth center. If a complication develops, depending on what it is, you may need to add an obstetrician to your care or move your planned birth to a hospital. This ongoing screening is a big part of what makes birth centers safe for the people that they serve. Not everyone who begins their care at a birth center will ultimately have their baby at that venue. There's a few things that are worth sorting out ahead of time so that you're ready for when labor starts. Main one is knowing when to go in and who to call. Labor usually begins at home, and then your midwife will give you specific guidance on when to head to the birth center. A common guideline is 5-1-1, meaning contractions are about 5 minutes apart, lasting 1 minute each for at least 1 hour. Because a birth center is not open around the clock, remember you will have to call first, especially after hours, so that they can meet you there. And if you're not sure whether you are in labor, call. Your midwife can usually tell how your labor is going just by talking to you on the phone. It's also worth noting that arriving at a birth center involves much fewer logistical considerations than arriving at a hospital. There's not going to be a massive parking garage to navigate. There's no separate admitting department. After hours, you're not checking into the emergency room. A birth center is smaller and it's simpler to get into. And when you show up, the team is expecting you. So let's start with what happens when you arrive in labor. The experience is different from arriving at a hospital. There's no triage department, no admitting desk, no separate check-in process. Your midwife will check on you and your baby. They will listen to your baby's heart rate, check your vital signs, and assess how your labor is progressing. This may include a vaginal exam, but these are less routine than in a hospital setting. If your midwife determines that you are not in active labor, they may send you home. False alarms happen. It's better to go in and be sent home than to ignore real signs of labor and risk not making it to the birth center in time. So if that happens, don't worry, you would not be the only one to go in early. Labor at a birth center is meant to feel less like a medical procedure than a hospital experience. So the biggest difference is that the routine policies and procedures during labor are not the same as those in a hospital. Rather than continuous electronic monitoring, birth centers typically use intermittent fetal heart rate monitoring, referred to as auscultation. This means your midwife listens to your baby's heartbeat at regular intervals with a handheld Doppler. A Cochrane review comparing continuous electronic fetal monitoring with intermittent listening across 13 trials and more than 37,000 women found that continuous monitoring did not reduce newborn deaths or cerebral palsy, and it significantly increased the rates of cesarean and instrumental births. The upside of not having access to continuous electronic monitoring is you're not tethered to the CTG machine, so you have more mobility than you typically would in a hospital. And movement can make a major difference in your labor. A Cochrane review of women in the first stage of labor found that walking and upright positions reduced the length of labor, the risk of cesarean, and the need for an epidural with no apparent downside for mothers or babies. Birth centers also typically encourage you to eat and drink during labor. This is notably different from the typical hospital approach, where solid food is often restricted and where they routinely use IV fluids. Also, hydrotherapy, which is the use of water during labor, tends to be a core comfort tool in most birth centers. Most centers will have a deep tub or a birth pool. Plus, you're usually permitted to go through the second stage of labor and birth in water. Most hospitals, if they have the capability for water birth, will allow you to be in the tub for the first stage of labor, but then require that you get out of the tub to have your birth out of the water for the second stage. A birth center also tends to offer more flexibility than a hospital regarding who's present during labor. Many parents have their partner plus another support person, a doula, a family member. Birth centers still have policies and procedures, but overall, they tend to be less rigid than hospitals. Because routine procedures in a birth center setting allow you some more flexibility, you have more options, and one of those is for the position that you're pushing in. Hospitals, you tend to be directed to push on your back. A lot of that has to do with limited mobility or due to epidurals giving you limited filling in your legs. In a birth center, you're going to be encouraged to push in whatever position feels most effective and comfortable for you. That could be on your hands and knees, squatting, side lying. It could be using a birth stool or in a tub if you're doing a water birth. The mechanics of birth itself will be similar to that of a hospital. Your baby's born the same way. Your midwife is trained to support a safe birth, to identify any issues proactively. What tends to feel different is the atmosphere. A birth center is usually calmer, quieter, it's more intimate, and that's simply because it's a smaller setting with fewer staff members. Birth centers are really oriented to keeping you and your baby together. Unless there's a reason to do otherwise and some emergency comes up, your baby immediately goes on your chest for skin-to-skin contact. The umbilical cord is typically left intact for delayed cord clamping. Your midwife will support you through the third stage of labor. That's when you deliver the placenta. And if you have a perineal tear, that's something that your midwife would repair afterwards. The same routine newborn procedures that are offered in a hospital are also part of birth center care. What tends to be different is the timing. Birth centers tend to delay newborn procedures. They're really prioritizing that golden hour with your baby, that first hour after your baby's born, where you are initiating breastfeeding and bonding. Your midwife will assess your baby's well-being in the first few minutes. They want to get an APGAR score, but they'll often delay other procedures like weighing and measuring your baby. Standard newborn procedures in the United States include a vitamin K injection and erythromycin eye ointment. Each of those has pros and cons. Of course, there are separate episodes that are a deep dive into the evidence on those procedures. Parents who choose a birth center are more likely to opt out of these. A CDC investigation found that about 3% of newborns in hospitals did not receive injectable vitamin K, and that was due to parental refusal, compared to about 31% at birth centers. And this isn't due to what's offered at a birth center. Vitamin K will be offered at your birth center. It's just a difference in parental choice. Parents who tend to minimize birth interventions also tend to minimize interventions for their newborns. State law is also a factor here. Some states mandate eye ointment for all newborns, and a birth center has to operate within the law where it is located. There's a couple of newborn screenings that come with extra logistics at a birth center. The newborn metabolic screen, which is the heel prick blood test that checks for rare genetic and metabolic conditions, and the newborn hearing screening are all part of standard newborn care. But where and when they happen will vary depending on your birth center. The heel prick may be done at the birth center after your birth or at a follow-up visit. The hearing screen may be available at your birth center sometimes on a later date. It's typically not done before you go home, or it may need to be done elsewhere, which means that you have to schedule it and get to that appointment. Your birth center should provide instructions on how to navigate any screenings that are not available on site. One big difference between a birth center and a hospital is how soon you go home. A hospital stay after a vaginal birth is usually a day or two. After a birth center birth, you typically go home the same day, often within a handful of hours, once your midwife is confident that you and your baby are both stable and doing well. Before you leave, your midwife will check both you and your baby. They'll talk you through what to watch for, give you guidance on caring for yourself and your baby, and then confirm your follow-up appointment. It helps to have your partner or another support person present for this discharge conversation. There's a lot of information, and having a second person there will make it easier to remember. I also recommend recording this so that you can refer back to it if you need to. The midwifery model tends to include more frequent postpartum follow-ups than a typical OBGYN. Depending on the birth center, that may mean a visit to the center within the first day or two. Some midwives may make a home visit. That's something you would want to ask about ahead of time so you know what to expect. One of the most important things to understand about a birth center is what it does and does not offer. You can expect fewer interventions for two reasons. First, the whole model is oriented towards physiologic birth, so interventions are used sparingly. Second is that some interventions are simply not available. The two interventions that are clearly hospital only are an epidural and a cesarean. If you want or need either of those, you would have to transfer to a hospital. There's a few other interventions that are not part of typical birth center care. The first is labor induction or augmentation with Pitocin. That's typically not done at a birth center because it calls for continuous monitoring and it falls outside of the low intervention model. Although birth centers don't use Pitocin to induce labor, many do carry Pitocin if it's needed to manage postpartum bleeding in the third stage. Also, an assisted vaginal delivery with forceps or a vacuum is usually not part of birth center care. If either of those are needed, then a hospital transfer would be required. It is very imperative that you understand what choosing a birth center means for pain management. You will be relying on non-medical comfort measures like movement and position changes, hydrotherapy, breathing and relaxation techniques, counterpressure, massage, continuous support from your team. These are real evidence-based tools. But because a birth center is unmedicated, preparation is mandatory. One of the most common reasons that an unmedicated birth does not go the way that someone hoped is simply not preparing for it. I highly recommend a childbirth class focused on unmedicated birth. A doula can also be a really invaluable tool to have by your side. And your own education and preparation will help you build a real toolkit for coping with contractions. If you do decide during your labor that you want an epidural, it would require that you transfer to a hospital. The takeaway here is that a birth center is a specific choice for a specific kind of birth. So going in with a clear understanding of what is and what is not available and a real plan for managing labor without medical pain relief is what makes a birth center work like it is designed to. Next, we're going to talk about the evidence on safety and outcomes. Before we do that, I would like to thank the sponsors that have supported this episode. A lot of companies have exclusive discounts for Pregnancy Podcast listeners, and you can always see discounts and promo codes at pregnancypodcast.com/resources. Not all prenatal vitamins are created equal. Zoller goes above and beyond using the latest scientific research to formulate their Prenatal Plus DHA with high-quality bioavailable ingredients. The Zoller Prenatal Plus DHA is sourced directly from nature, containing pure, unadulterated ingredients to meet the highest standards. This vitamin is carefully formulated with the nutrients that you and your baby require in the optimal ratios for absorption, metabolism, and safety. One of my favorite things about the Zoller Prenatal is that it contains omega-3s like DHA. Very few prenatal vitamins include DHA, and your DHA levels directly impact the central nervous system and the cognition of your developing baby. With 300 milligrams of DHA included, this is one less thing that you need to think about. In the month of May 2026, save 40% on the Zoller Prenatal Plus DHA vitamin on Amazon with the code PREPODS40. You can always check for the current promo code for the Zoller Prenatal Vitamin at pregnancypodcast.com/vitamin. When you're trying to get your baby to sleep, every little thing matters. The right sound, a soft light, the ability to soothe them without walking back into the room can make a difference. A good monitor can actually help with that. The VTech VM5266 video baby monitor is designed with sleep in mind. It has a 5-inch color LCD screen. It lets you pan the camera 270 degrees. You can tilt and zoom from the parent unit so that you can check every corner of the room without opening the door. The baby unit has a touch adaptive multicolor nightlight, and there's sound activated soothing that automatically turns on the nightlight or the projection when your baby stirs. You also get lullabies and ambient sounds, a 2-way talk back intercom, a temperature sensor, automatic infrared night vision, up to 1,000 feet of range, and 17 hours of battery life on the parent unit. This monitor is not Wi-Fi connected, which many parents prefer for privacy and simplicity. VTech is the #1 baby monitor brand in North America, and they're trusted by millions of families. The VTech VM5266 is available at Target. Check it out at pregnancypodcast.com/VTech. Let's get back to today's episode. For a lot of people, the idea of giving birth anywhere other than a hospital sounds unsafe, maybe even a little scary. The honest starting point is that there is less research on birth centers than on hospitals. And that's simply because birth centers are a much smaller share of births. There is, however, solid evidence that birth centers are a safe and viable option for low-risk pregnancies. The cornerstone study is the National Birth Center Study 2. This followed over 15,000 women who planned to give birth at one of about 80 birth centers across 33 states. More than 9 out of 10 participants who entered labor planning a birth center birth had a vaginal birth. The cesarean rate was about 6%. For comparison, the low-risk cesarean rate in the United States for first-time moms who have a single baby, full-term, head down, so considered low risk, is 26.6%. Of course, a cesarean at a birth center requires a transfer to a hospital. That's a little bit more involved than being wheeled down a hallway. And that reality certainly contributes to the low cesarean rate. Even so, that's a very big gap between 6% and 26.6%. The study found no maternal deaths. The stillbirth rate was 0.47 per 1,000. The newborn death rate was 0.4 per 1,000. Those rates, I know they sound scary, they are comparable to what researchers report for low-risk pregnancies in other settings. Because that National Birth Center study did not include a hospital comparison group, it could not directly answer whether birth center births are as safe as hospitals. A more recent study helps fill in that gap. A 2024 study used national birth data from 2018 to 2021. They analyzed roughly 8.7 million births, including more than 40,000 in birth centers, all of them low-risk pregnancies. The researchers looked at a range of newborn outcomes, including newborn deaths, seizures, APGAR scores, chorioamnionitis, that's an infection, the need for breathing support, and admission to a neonatal intensive care unit. Comparing birth centers with hospitals, they found no significant difference in newborn deaths or newborn seizures. They also found that chorioamnionitis, very low APGAR scores, NICU admission were actually less likely among birth center births. This is recent, large-scale evidence that supports what the older research suggested, which is for low-risk pregnancies, birth centers are a viable, safe option. We get a broader picture from an integrative review that pulled together 32 studies involving more than 84,000 women across several countries. Across the board, women who began care in a birth center had higher rates of spontaneous vaginal birth than women who began care in hospitals. Several studies found lower rates of episiotomy, higher rates of an intact perineum after a vaginal birth. Some studies found that labor was longer for women who started in birth centers, and where satisfaction was measured, women reported a positive experience with birth center care. There's one important thing to keep in mind when we're examining research on births at a birth center. The strong outcomes in this research reflect low risk, relatively healthy pregnancies. I know I have mentioned this throughout this episode. Birth centers are not designed for higher risk pregnancies, and the careful ongoing risk screening that's part of your prenatal care is ensuring that this model is safe for the people that it serves. It's also worth noting that birth centers remain small in number, and they're not necessarily accessible to everyone. According to the American Association of Birth Centers, there are currently more than 400 birth centers in the United States. That number has grown over the long term, but birth centers also close, and many face real financial pressure. Part of that comes down to how birth centers get paid. Hospitals are paid a separate facility fee, and they charge for the use of the building and its resources. But there's no federal mandate requiring insurers and Medicaid pay freestanding birth centers an equivalent fee. On top of that, insurance and Medicaid tend to reimburse birth centers and the midwives that staff them at lower rates. That means that a birth center can be paid less than a hospital for the same birth. All of this makes birth centers hard to sustain financially. Licensing rules also vary widely by state. Some states make it very difficult for birth centers to operate at all. And none of that is a safety concern. It's really an access concern. And it's part of why a birth center may be a realistic option in some communities, but not others. Let's talk about cost and insurance. Birth centers have lower facility costs. They use fewer interventions. They send you home the same day. All of that tends to add up to a smaller bill. But the challenge is insurance. Coverage for a birth center is less consistent, and it's harder to navigate than coverage for a hospital. Whether a birth center is covered, how much, really depends on your insurance plan, the state you live in, and the birth center itself. Many birth centers have staff that help clients work through coverage. Some offer payment plans. The best approach is to get on the phone with your insurance company directly and ask specific questions. Trying to piece it together online rarely gives you a clear answer. It's really confusing trying to sort out whether a birth center is covered. It's also a good idea to ask how your coverage would work if you were to transfer to a hospital. I won't get into details on navigating the cost of birth and insurance. That is a very confusing topic that has a full dedicated episode that covers that in detail. One thing that we have not covered yet, we have to get into, is talking about transferring to a hospital. You have to understand that if you plan a birth center birth, there is always the possibility that you will need to transfer to a hospital. You can't ignore that. You can't gloss over it. If you're considering a birth center, you have to be realistic that a transfer is a possibility. I don't say that to scare you. I say that because I want you to prepare. It helps to know what a transfer usually looks like because it's rarely what people picture. Most transfers are not emergency 911 calls in an ambulance. Far more often, a transfer happens because labor is not progressing, because you've decided you want pain relief and that's only available at a hospital. Or it could be because your midwife sees a sign that a hospital would be safer well before anything becomes urgent. The National Birth Center Study does give useful numbers on how often transfers happen. Of the women who planned a birth center birth, who started their labor there, 84% gave birth at the birth center. Across the full study group, about 12% transferred to a hospital during labor, and around 2% transferred after giving birth. Then there was an additional 2% that had their babies transferred after birth. Most in-labor transfers were not emergencies. The most common reason was that labor was not progressing. Fewer than 1% of the study group transferred during labor for an emergency reason. Of the women who did transfer during labor, more than half still had a vaginal birth. So even if there is a transfer to a hospital, that does not anyway mean that the only option from there is an emergency cesarean. One factor that you should weigh in when you're evaluating a birth center is how close the nearest hospital is. A hospital 5 minutes away is a very different scenario from having a hospital an hour or two away. How quickly a transfer could happen if needed and which hospital you would go to are reasonable questions to ask, and you should factor those in your decision. The reality of a transfer is exactly why a backup plan matters. When you have a solid backup plan, you're going into your birth more confident because you're prepared to navigate any scenario. Hopefully, you don't ever have to use your backup plan. But if circumstances change during your labor and you need it, you're ready. The foundation of a backup plan is an in-depth conversation with your midwife well ahead of going into labor about exactly what a hospital transfer would look like. It's also worth knowing that many birth centers will require you to meet with an obstetrician during your pregnancy and identify a specific physician in the event that you need to transfer. When you're exploring your options here, there are specific questions worth asking. One is, which hospital would you transfer to? And if your preferred hospital is not the closest one, what's the nearest facility? In the event of an emergency, you may have to be transferred to the nearest hospital. I would also ask if the birth center has obstetricians or a hospital that it works with regularly. That way, the transfer is into an existing relationship rather than a more cold handoff. And what happens to your midwife's role if you transfer? Depending on the circumstances and the laws where you live, some midwives can continue with you in a support capacity, kind of like a doula. Others may have to just hand over your care completely. I would ask your midwife to walk you through all of this so that you understand what that scenario would look like. Because a hospital is the backup setting for a birth center, there is an episode on hospital birth. I really recommend that you listen to that. That will be useful preparation, even if you fully expect to give birth at the birth center. Knowing what to expect from a hospital birth is part of being ready for any scenario. A fantastic way to plan for your birth is to actually go through the process of creating a written birth plan. The value here is not the final piece of paper that you end up with. The value is really the process that you go through and working with your midwife to create it. The Pregnancy Podcast has a lot of resources to help you create your birth plan. I will link to all of those in the article for this episode. No matter where you plan to give birth, the single most important relationship is the one with your care provider. Your midwife is your trusted partner through your pregnancy, and they're your connection to the broader medical system if you need it. Use your prenatal appointments to work out details, to ask all your questions. Those longer education-focused visits at a birth center are designed exactly for that. Talk through all your preferences, go through your birth plan, go through your backup plan, and ask how your midwife handles the situations that are really important to you. The more aligned that you and your provider are before labor, the closer you will get to your desired birth experience. Also, remember that you're never locked in. So if you start with your care at a birth center and a particular midwife doesn't feel like the right fit, or you're not happy with the care you're receiving, or you think that you want to change to a hospital, that's always a possibility. The goal of this episode is really to help you understand your options. If you're even mildly curious about a birth center, go tour one. Touring is something to do early. That's not something you want to do just before labor. If you have more than one birth center in your area, I would visit all of them. They are very individual places, so there's going to be differences in size, amenities, staffing, policies, and a big difference between the general feel. A tour lets you meet some of the midwives and get a sense of whether a particular center is the right fit. You may take a tour of a birth center and decide that that is definitely not where you want to have your baby. And that's a great outcome too, because it allows you to be more confident in whatever choice you make. The main takeaway, remember, you have options as long as you know what they are. And the best birth is one where you feel supported and empowered. And a large part of that is matching what you want to the right venue for the experience that you're looking for. This episode is one of 3 on birth venues. A separate episode covers what to expect from a hospital birth, and then another covers home birth. Exploring all 3 is really the best way to feel confident in whichever place you choose to welcome your baby. To recap everything in today's episode, we started with what a birth center is, a home-like setting. We talked about the midwifery model, what a birth center does and does not have, and who is eligible to give birth at a birth center. We went through the different types of midwives, looked at what to expect from prenatal care, how to prepare for giving birth at a birth center, and then walked step by step through the experience from arrival through going home. I also went into pain management. We talked about what is and is not available, touched on water birth, and spent a lot of time reviewing evidence on safety and outcomes. I'd like to thank you for tuning into the Pregnancy Podcast today. I hope that you find this episode helpful. If you have a friend that's pregnant, please share the Pregnancy Podcast. So many listeners discover the podcast through recommendations, and I appreciate you sharing it. As always, you can reach me, Vanessa, at pregnancypodcast.com. You can read the full article and see all of the resources that accompany this episode at pregnancypodcast.com/birthcenter. If you are weighing your birth venue options, premium members have access to companion episodes on everything and deep dives into every intervention and pain management option, including all of the unmedicated options. There are hundreds of evidence-based episodes, all completely ad-free, that are not available anywhere else. Check out Pregnancy Podcast Premium at pregnancypodcast.com/premium.